Neonatal traumatic head injuries. Occasionally it happens. In fact, 3% of the pregnancy has this sort of mishap and responsible for the 2% of the neonatal death. Common causes over here are the cephalopelvic disproportion, either large head or contracted pelvis. Prolonged labor, are certainly the outcome, breech delivery and transverse lie, precipitate labor, and your other inferior causes may be abuse in differentials. So these children have usually their subdural hematoma. If they really do have some sort of mishap in the brain, the tear of tentorium cerebri and fox cerebri. So there can be massive hemorrhage in catastrophic sort of neonatal traumatic injury. Some of them, who has this severe sort of insult may die immediately after birth, and in fact 2%. But most survivors do have the resolution of the hematoma by 1 month or so, without any intervention even. So no worries in that way. At the same time, there can be little bit of chronic subdural hematoma progression in small subset of cases. These children has large head, macrocephaly, balls fontanelli, and frontal bossing, and there can be anemic by dint of bleeding, and there can be the spasm. The little bit of convulsion is possible, and so diagnosis of these cases are CT and MRI, and the symptomatic hematoma, the big one especially, should be evacuated by a neurosurgeon. Subarachnoid bleed can have raised CSF RBC. So the sequelae over here may not be that high. So intracranial hemorrhage and periventricular leukomalacia are common in traumatic injury.